Friends, I'm Dr. Paramjeet and you're watching Dr. Education. Today we are going to talk about neck pains. Many of us, almost everyone, has had neck pains sometime or the other. But neck pains are not just because of muscle sprains. But yes, most commonly neck pains are because of muscle problems, muscle sprains, muscle spasms, but they are not the only cause. There can be 5 problems. There can be 5 things which have problems in your neck. Bones, muscles, joints between the bones, the cartilage between the joint, the disc also includes in the cartilage, and the nerves. So there can be all these 5 things which can have problems causing neck pain. So let's see individually what are these problems which can damage these parts of your neck.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So most commonly the cause of neck pain is muscle stiffness, muscle spasms and muscle sprains. All these problems are usually because of wrong postures and sleeping in the wrong position. If you keep your computer screen little too high or way too low and you always check out your mobile with this kind of a position, then you will definitely have muscle spasms. Even tension can lead to muscle spasms of your neck muscles, because tension, fear, all these things lead to an involuntary response of neck muscle spasms, jaw muscle spasms, which can even lead to headaches. So guys, neck spasms, neck sprains are most common and commonly caused by stress, wrong positions during sleep, as well as traumas. Yes, if you fall or you pick up a weight very quickly in a sudden jerky movement, any kind of heavy object can lead to muscle sprains and muscle spasms in your neck. And even exercising in a wrong position with inappropriately heavy weight very quickly can cause neck spasms. Then trauma. Trauma can injure your bones in your neck as well as the joints, the muscles and the disc. When you fall, you can injure either of them. In the bones, you can have fractures, hairline fractures, you can have infection in the bones, osteomyelitis or even abscess, pus collection in the bones. Then bones can have arthritis, which is an inflammatory response which can alter the structure of the bone, then compressing the nerves which are coming through the bones, and even can compress the spinal canal which is there between the cervical bone. And the spinal canal, if it gets compressed, it can actually compress the whole nerve supply of your lower limb, lower bodies, lower side, lower below the neck. Can actually compromise the nerve supply of your body, and you can have neurological problems like tingling, numbness in some part of your body, specifically in arms or forearms, or you can have bladder problems, incontinence of urine, and all these neurological problems can happen because of nerve compressions. And nerve compressions can be a secondary thing to bony abnormalities and even disc herniation. Trauma can cause problems in the disc. Disc is there between the 2 vertebrae, the bones, between the cartilage. In the cartilage, between the bones, there is a cartilage, and cartilage has a disc. It acts like a cushion. It helps to allow the motion between your neck bones, so that you can do all sorts of motions in your neck. But when the disc is ruptured or injured, or even if the covering of the disc is broken and disc can herniate out and come out on one side, pressing the nerves, because every single bone has many nerves coming out from above and below, so nerves can get compressed because of disc herniation, bony abnormalities, bony infections, bony arthritis. So all these things can cause various problems in the neck, leading to neck pain. Even spondylosis, which is a degeneration of the cartilage between the bones, can cause all these things, and even cancers are found in the neck causing bone problems. So all these problems can lead to neck pains, and the treatment of these depend upon finding the basic problem, and in order to do so you should go to an orthopedician or a neck spine specialist who will investigate your problems by doing some blood test, x-rays, CT scan or MRI, and find out where exactly is the problem is, either in the bone, the joints, the muscles, the nerves or the disc. So all these things have to be checked, and only after pinpointing the problem you can have a permanent relief from this neck pain, or else taking painkillers or relaxing muscle relaxants can have temporary effect, and if you are lucky and have just some neck stiffness or neck spasms, then you can get relief by that itself. But if it is a problem involving your nerves or the disc or bones per se, if there is an infection, then you will have problems again, and even a more severe one, and you might land up into an emergency. So better to get investigated and pinpoint the problem before it gets worse. So there are certain things which you need to look for. If there are some signs, like if there is fever or headache associated with neck pains, or there is neck stiffness per se, if there is neck stiffness, that means if you cannot touch your chin to your chest like this. So if you are not able to do that, then there is a stiffness in your neck muscles, and in the presence of fever and neck pain, it indicates meningitis. So meningitis is an infection inside the covering of the brain, which is a very severe and life-threatening condition which needs urgent admissions and ICU care. So all these things have to be looked for. Plus, if you have neck swelling, if there is nodes found in your neck, if there is breathing difficulty, or if you have any neurological problems, tingling, numbness or weakness in some part of the body, then that is a sign where you should directly head to the emergency and show and get admitted for evaluation. Now, there are certain things which you can do at home to get relief from most common muscle problems of the neck. Those are, first thing which you can do is rest. Yes, first thing is rest. Rest your neck and your muscles for at least 2 days. Yes, rest. Rest your neck muscles for at least 2 days. At least 2 days. Restrict your neck movement to very small movements. Whatever is not causing pain can be done. Then proper correct posture is very important, especially while sleeping. Sleep on a flat and firm mattress with a certain thickness of pillow which allows a straight neck position. Neck should not be dropping down or flexed. So neck should be in a straight and relaxed position while sleeping. Along with this, you can even do some ice and heat treatment. Yes, that is common, but for the first 2 to 3 days, it's recommended to use ice. Ice actually prevents swelling. So initially, when there is a trauma or there is a muscle sprain, initially there will be some swelling which will increase for the first or second day. Then first 2 to 3 days you should use ice. Ice actually prevents swelling, and that's why it will help and prevent further injuries. If there is a neck pain for more than 3 to 4 days, then after that you can use heat. Heat compressions can be used, but make sure not to sleep with the ice or heat compressions on your neck, because that can cause serious problems in your skin and superficial muscles. So sleeping is not advisable. Intermittent ice and heat treatment is advisable. So all these things can be done. Rest, ice and even compressions. You can ask your doctor if you need a neck collar. Neck collar can be used for a limited amount of time to prevent motions if neck motions are causing pain. And with these collar, you get time to investigate the reason of your pain and get them treated as soon as possible. But make sure not to wear the neck collars for more than a few months, because then your muscles, neck muscles will get weak. Apart from all these, over-the-counter medications like painkillers and muscle relaxants can be taken for a temporary relief, but mind it, they are not the permanent cure for your problem. Cure will only be there. You will only find a cure after finding the basic cause of your neck pains. So meet your doctor, discuss all these points and find out where exactly is the problem, and then you will be able to get rid of it for good. If you have any questions, do write to us. Don't forget to subscribe this channel. There are many videos in this channel, both Hindi and English. So if you want certain topics to be covered in English or in Hindi, then you can opt for it. Tell us about your views. Don't forget to share these videos to everyone. I am Dr. Paramjeet and you're watching Dr. Education.